We experience the world as a seamless fusion of perception and feeling. When we encounter joy or fear, sensory details merge with internal reactions. We assume our inner awareness and emotions are the same thing. Alan Davies and his wife Christine shared a marriage defined by a warm, daily routine. Alan was a spontaneous man who made a habit of greeting Christine every morning by telling her he loved her. During a drive in 1995, a severe collision left Alan in a state of shock. While he recovered physically, his psychological state underwent a drastic shift. When Christine returned to him, Alan recognized her face and her voice, but he was convinced she was a stranger impersonating his dead wife. He began calling her Christine, too. Capgras syndrome stems from a measurable physical tear in the brain's architecture. The trauma of the accident damaged the long, thin fibers called axons that carry signals between the visual cortex and the brain's emotional centers. Signals normally bridge the microscopic gaps between neurons to generate a sense of familiarity. In Alan, that chemical bridge collapsed. Alan could trace the physical lines of his wife's face, but the visual data never triggered the deep affection she once evoked. Because those signals were missing, his brain interpreted his loved one as a well-dressed stranger. Consciousness can remain active even when the biological capacity for attachment is severed. We can witness a larger subtraction by examining the prefrontal cortex, the regulator of our social impulses, located just behind the eye sockets. In 1848, a premature dynamite blast launched a metal rod through the head of railway foreman Phineas Gage. The rod obliterated a massive chunk of his prefrontal cortex, forever changing his personality. Incredibly, Gage survived the trauma and remained awake, but he lost his impulse control and his sense of social shame.
He could no longer access the moral database that guides human interaction. Neurologists use a gambling test to map this specific type of deficit. Patients draw cards from different decks, trying to distinguish safe returns from risky losses. This chart shows a healthy body's reaction. When reaching for a risky deck, the line jumps, an unconscious sweat response. But for patients with prefrontal damage, the monitor flatlines. Their body provides no physical alarm to a dangerous choice. Without these somatic markers, the mind navigates a world of risk without a compass. By the 1930s, the medical establishment attempted to treat psychiatric disorders by intentionally recreating these deficits. Portuguese neurologist Antonio Egas Muniz won a Nobel Prize for pioneering the lobotomy. In America, Walter Freeman popularized the procedure, performing brain surgery on an outpatient basis. Using an instrument driven above the eye sockets, surgeons severed the white matter connecting the frontal lobes to the rest of the brain. The surgery produced a quiet, docile ward. Patients lost their spontaneity and their emotional drive, often becoming indifferent to the world around them. By forcing calmness through disconnection, doctors effectively erased human initiative. Across these cases of severe disconnection and traumatic brain injury, did the core of their consciousness actually flicker out? No. These patients still vividly perceived the world, despite their lack of empathy or physical emotional feedback. The brain's emotional network functions as a critical filter. Our prefrontal cortex acts much like a magnificent piece of stained glass, bending raw perception into colored meaning and moral direction. Consciousness is a resilient spark that survives the loss of our feelings, but it is those emotional networks that make the experience human.